from Moscow, Russian Federation.
Thank you very much for invitation for this beautiful congress. Thank you very much for everybody who organized this conference in this beautiful place. So I will talk about our experience. First of all, everybody knows about mobility of lumbar spine, and as Professor Killinger asked a very good presentation. So there are a lot of devices for dynamic stabilization of lumbar spine. They call dynamic or semi-rigid. And we, in our practice for last 10 years, use rods which produced in 1900. 1900, it's alloy of titanium and nickelite, and they have very good properties. It's shape memory effect and also effect of superelasticity. So it's effect when the load is removed, the ability to return to its original state. This is picture of graphic representation of the properties of superelasticity. You see after the deformation, this alloy back to the initial state. We have some cadaveric tests. This is picture of the our rods, size and different flexion. So how it works? Nitinol rods are cooled to temperature below 10 degrees, which is necessary to preserve the crystal lattice of the metal. It's necessary to preserve intervertebral joints. The rod may not be cooled if the spine is not deformed. It's possible to perform additional modeling intraoperatively, as rods are stored in cold ceiling. Can you help me with this video? No. Here is the flexion of these rows. You see that it's come back to the initial state. So we have a multi-center study for centers in Russia. We have a lot of scientific works. And after this multi-center study, we have no statistically significant difference in functional scores, only the difference of range of motions. And this is conclusion of our multi-center study. Nitinol rods allows a small amount of movement in each fixed segment. The use of nitinol rods simplifies the technique of surgical intervention. And the result of the multi-center study provide evidence of the effectiveness of the stabilization approach at 1 and 2 levels in young and active patients. 10 years after. Overall, we have more than 500 patients, and we have 114 patients with 10 years follow-up. This is complications associated with implants. And due to the significant difference in complication depending on the level of fixation, all patients were divided depending on the segments of fixation. And this is a group with nitinol rods, and you see that there is a lot of complications in the patients with 2 and 3 segments fixation with S1 fixation. The total amount of the complications is 18%. And this is a group 2 with standard rigid rods. It's also about 18% of complications, but most of all it's instability of implants, pseudoarthrosis, and the problems with this adjacent segment. This is male after 10 years follow-up, and he have a rod fracture after 10 years. And also, can you put this video also. Excuse me. No. No. No video. Oh, thank you. And you see, after removal of the 19 rods, there is some range of motion. So, and this is conclusion after our 10 years experience. The use of 19 rods in lumbar stabilization surgery showed good result in comparison with titanium rods for 1 and 2 segment stabilization. 19 rods allow to preserve mobility in the motion segments 10 years after surgery. The application of this method will reduce the number of complications typical for the rigid fixation. And the main indications are fixation of 1 or 2 level without fixation of the L5S1 segment and fixation of only the L5S1 segment. Also, I am glad to invite everybody to St. Petersburg this June to our Congress of Russian Association of Spine Surgeons. Thank you.